I'm John Hagan, co-host of Shift by Alberta Innovates, our podcast with a focus on researchers, innovators, and innovation. In the fall of 2020, Alberta Innovates announced $2.1 million to go towards research and innovation projects looking to slow the spread and lessen the impact of COVID-19. Today, I'm speaking with Dr. Puneeta Tandon, Associate Professor within the Faculty of Medicine and Dentistry at the University of Alberta. Hers was one of 7 to receive Alberta Innovates funding. Good morning, Dr. Tandon. How are you?
Good morning, John. I'm doing really well.
Excellent. We're so happy to have you here today. Now, the title of your project is Providing Multidisciplinary Care to Outpatients in the Time of COVID-19. Now, what does that mean? Can you describe that to us in lay terms?
Yeah, sure. So, obviously, I don't need to tell everybody how big of an impact COVID has had on our society. And there's those direct effects of COVID, the actual infection, but then there's also obviously the indirect effects. And that's what we're attacking in this grant. So, the indirect effects of social isolation. We know it's so important to follow all of those safety measures, but it has a tremendous impact on mental health and on physical health. And it's really disconnected people from the behaviors that they may have been used to, like going to the gym or eating well, and that sense of community that we've all been used to. So that's important for all of us, but it's really important for patients with chronic disease who are particularly vulnerable. And those patients are at risk of what we call frailty, which is a medical condition where they lose muscle mass, they lose muscle strength. It impacts their quality of life, impacts their ability to function, and it even impacts their quantity of life, so their length of life. So this grant, we're looking for a solution to improve that physical and mental health in people who are at high risk.
So is this considered a clinical trial? Is it a physical exercise program? Is it a social interactions?
It is a clinical trial. Yeah, it's a randomized control trial, and we have 3 study arms in there. So the first is a control group where they get resources given, emailed to them about nutrition and exercise, and that's fairly what we would do in standard of care, even perhaps more than what we would do in standard of care. The second arm gets a little more support, and so they get a meeting with a dietitian and an exercise specialist at baseline, and then they get the app. And so the app has their program on them that's been specifically designed for them, and they follow that nutrition and exercise program for 12 weeks. And they get the opportunity to interact with the team through group sessions. So they come together with other patients and have group nutrition and group exercise sessions. And the third group gets sort of Cadillac support. And that's where we want to see who benefits the most, and whether or not group 2, for example, that I described is the same as group 3. So the group 3 Cadillac support, they get that same baseline meeting with a dietitian and an exercise specialist. They get the app, they get their programming. In addition to group sessions, they actually get to meet with one-on-one with their trainer and with their dietitian through the course of the 12 weeks. So that's really what we're trying to see, is how much support do people need and how effective is this kind of programming delivered through an app.
That's so cool. Now, where are you at in terms of recruiting?
It's going so well. So we started in December, and we've already got 120 people in, which is pretty cool. So yeah, so far so good. We have a target of 216 that we need to reach by the end of the funding period. So we're well on our way to getting that.
And when is that? When is the deadline?
Ideally, it'll be by the summer, fall kind of thing of this year. So we should have some results by the end of the year.
Oh, well, that's great. Okay, so you're looking to get your cohort of people, 216, by the summer or the fall, and then you're going to start the program, and then you're hoping to have results before the end of 2021.
Oh, the program's already started. So our first cohort has actually already gone through with their 12 weeks. They're going to have their end of 12-week testing in March. Yeah.
I see. Okay.
In batches, just to keep it manageable for the team. And it really, I must stress how much of a team effort this has been. There's been a lot of people involved to try and run a project like this so quickly and so efficiently as we've been going.
Now, how many different sites are you guys doing this at?
For this one, we're just doing it in we're running it out of Edmonton, but of course it's virtual, right? So the testing is virtual, the training, all of the interactions are virtual. So we've got some rural and remote participants as well.
Excellent. Okay. Well, that's fascinating. So you're hoping to have the results by the end of 2021. What does the ideal situation look like? What would be the best outcome to see with this?
Yeah, it would be so great to see that obviously we improve nutrition, improve physical activity, and strength and mental well-being in this population, and by population I mean this diverse group of individuals, and obviously get a real sense of how much support they need and how we can better make sure that the care that we give people is equitable. So not only across geographic location, but also how much technology support does someone who's maybe a bit older or not as experienced with technology, how much support do they need as compared to someone else? I think
Yeah.
this virtual care is sort of here to stay, and we just need to make sure that we are providing people with the support that they need to benefit from it.
Oh,
So I
yeah.
think we need to really listen to what our patients need, and if we can provide it to them, we're bound to see benefits as far as economic benefits and benefits in health that will go much beyond just the period of a grant.
So tell me a little bit about that. What happens after this project is done? You have your results. What's next?
Yeah, so the ideal situation will be that this is integrated within our healthcare system for all people to have access to it, and so that it's made seamless so that clinicians can also, perhaps even have it integrated within what's called our electronic medical record. I don't know if you know about Connect Care, but that's spreading across the province as our EMR. We need to connect patients to this kind of care.
Yeah.
Pandemics may not come again like this, but we know there's many gaps in delivery of this kind of care, and ideally this will be available to every Albertan who needs it.
Dr. Tandon, this was really great. Thank you for spending some time and explaining this to us. We're eager to watch and see what happens. All the best.
Awesome. Thank you so much. Take care.